Okay, hello everyone. For this topic now, for the palliative care nursing subject, we will discuss about end of life care. So please prepare your notes and your pen. Please listen to the recording, to the material recording, and please write everything that you need to note. And if you have any question, you can drop your question in the discussion forum. Okay, for this topic, we will discuss about the concept of the end of life. And then we will discuss about the science of dying. Moreover, we will discuss about the preparation in the last hour of life. Also, we will describe about the nurse's role in the end of life. We also will discuss a little bit about advanced care planning and the role of the nurses after death. Now, the objective of the topic for this week is that it is expected that after completing this session, all of you students will be able to, the first one, understand the concept of end of life care, the second one, understand the principles of end of life care, and the last one is to apply the important principles of end of life care when you do your clinical exposure. Now, we are going to begin the topic of end of life care. End of life care includes physical, spiritual, and psychosocial assessment and care and treatment delivered by health professionals. Health professionals means doctors, nurses, physiotherapists, dietitian, and others, and ancillary staff. This also included support of the family and carers and care of the patient's body of death. So people are approaching at the end of life when they are likely to die within the next 12 months. You can consider as end of life care, or those people who are in this stage, they need the care of end of life. This also includes people whose death is imminent. Imminent means that the death expected within a few hours or days. Those people with this kind of definition is that people who have an advanced, progressive, incurable conditions. Maybe you can name those illnesses, such as cancer or any chronic disease or chronic illness in the end stage, and also the general frailty and coexisting conditions, and they are expected to die within 12 months. So what do you think are the signs of the dying process? I think in general you may name it one by one. Now I will discuss this with you. So the first one, there will be a failure in the neurological system. It can be the changes of the level of consciousness. From the compos mentis become somnolent or even coma and die. The second one is that the pattern of the breathing is abnormal. It can be like the type or the pattern is the inspiration and expiration is not the same. Or maybe you ever heard about sense talks, that the breathing is like ups and down. The next one is loss of the swallow ability. There are secrets in the oral or trachea. Maybe sometimes patients comes to the delirium station. Loss of the sphincter control. So it become like incontinentia in feces or incontinentia in urinal. There is a cardiac failure, tachycardia, cyanosis, the peripheral getting cooler, there is a renal failure, oliguria or anuria, no urine at all. It is very important that patients to be treated with dignity and respect them at the end of lives. So remember, even though in the end of life care, you still need to pay attention to their needs because you're dealing with human being. Respect them, treat them with dignity. Even though they will not respond to you, they still hear whatever you say to them. Ensure that pain and suffering is minimized. Make sure that they not live in the end stage with pain. Make the optimal quality of life of the patients. They have access to all their needs, all the aspects of the needs. You may coordinate with all the services that the patients or the family needs. Make sure that you improve the quality of care. You provide the best quality of care to the patients during their last day of life. And remember to support the carers, the family members, during this stage. So what tasks should the patients complete before dying? Maybe you ever heard about the advanced care planning. This is the plan where patient can verbally express their needs when they are still conscious. What do they need? What do they want? Let's say, for example, we will discuss more later on, but for example, where the patient would like to be treated, whether at home or in the hospital. They also need to settle about the financial planning. When someone have a chronic disease, they might stay in the hospital in a very long time. They need more funding for treatments. Maybe some treatments will not be covered by the national insurance. So what should they do? What should the family do? Is there any living wills? Someone who will become the person in charge to speak on their behalf when they are become unable to express their needs. Anything that or anyone that dependent on the patients, maybe children, wife or husband, or maybe family members, parents, pets, belongings. What kind of rituals that patient want? Do they need to be prayed of? Do they want someone from their church or from the mosque to come? Who will take care of them if they want to go home? Who will take care of them? Or even in the hospital, who will take care of them? Where they would like to be treated, at home or hospital? How about after that? Is there any arrangement for the funeral? Maybe they talk about the organ donation or other things. So there are some physical nursing care for the dying patients. These three are the most important. Remember that you provide the care for the mouth care. Keep the mouth as clean and comfortable as possible as you can. When they become in the stage of end of life, they don't speak. The mouth is shut. They might develop oral thrush. So make sure you clean inside of the mouth, the lips, the tongue. It may also relate to the side effect of some drugs that they take. Or if they become unable to do the cleaning for the mouth, you do for them. If you cannot use the toothbrush, you may also can use the gauze and clean the mouth with a normal saline. Put something on the lips so the lips will not dry and crack. And that because they also did not drink through the mouth, that makes the mouth dry. So how about the pressure area? They might be bedbound. They will not be mobilized by themselves. Make sure that the surface where the patient's lying down or sitting on is something that is very comfortable for the patients. If it's possible to provide the mattress, the air mattress for them, provide so. You may need to change the position, elevate 30-degree position to reduce the risk of the pressure area. For incontinence, make sure that you clean the area, because when the patient is bedbound, lying in the same position with the incontinentia, the urinal and feces is very strong, bring a strong impact to the skin. The skin may tear, they may develop the pressure area. As the oral intake also limited at the end of life, please make sure that they still have the nutrition intake. Because in this stage they might malnourished, so they need the nutrition. Well, even sometimes in some of the books, end of life, sometimes they don't need this kind of nutrition. So if the treatment is not really bring a benefit to the patients, maybe intervention will not be given, because they also don't need much nutrition, as the energy will not much used for them, because they're lying down, they are bedbound. So due to the nutrition loss, the pressure area will take some time to get healed, or maybe even not will heal. Personal hygiene, this all will be related. So when you do the personal hygiene, you do the mouth care, you do the pressure area care. Now a little bit discussion about advanced care planning. It involves discussing and preparing for future decisions about medical care if someone becomes seriously ill or unable to express their wishes. So you may find so many documents or articles about advanced care planning, but these three are the most important points that you may need to remember. A patient has to think what matters most to the patients. That could be everything. Let's say the matters most for them maybe children, like who will take care of their children, who could make the health and personal care decision. They may choose someone. Let's say if it's a family, let's say the husband is the patient, he may choose his wife as the personal care person who will make all the decisions when the patient's unable to say something. Or maybe if they have children who are already mature enough, they may choose their family members, like the children the son or the daughter to make decisions for them. Whatever they want for themselves, for their life, for their end of life, they need to discuss those things to the family members or to the people who they trust, and even to the healthcare providers. Why? Because the healthcare providers need to know if they, in any chance they go to the hospital, at least the healthcare providers know what to do next and what to not to do for the patients. And these things have to be recorded and to be shared again with the family members, the people they trusted, and the healthcare providers. Now, I want I want to speak about good death. Good death is general definition for anyone, for any individual. You may have different definition for good death from your own perspective. But based on the resources, these are the things that makes a good death. As you can read, it includes the death is expected, not sudden, natural, to die where you want to. The place where you want to be, like in the home or hospital, who you want to be surrounded by. A peaceful and dignified death. There is a time for you to say goodbye. And you have already reached a degree of acceptance, free from any pain or any other symptoms. To have an open, clear, and honest communication, to be treated with dignity and respect, to have your wishes adhered to. No unfinished business. You are able to retain some control. Receive a holistic care. Receive an appropriate treatment, not a futile treatment. There is one article that myself and two other lecturers wrote. It's about Indonesian Christian nurses' perspective on peaceful death. This is a qualitative study, so we interview 15 nurses, Christian nurses, and we ask their perspective about peaceful death. These are the themes and sub-themes of their perspective. The first theme was the component of peaceful death. They mentioned about being a peaceful death, or peaceful death means that die with dignity, where patient can die with dignity. Patient has minimal suffering and burden, where patients and family accept the situation. There is a religious and spiritual concern, and that all patients' needs are facilitated. The second theme was companionship and care. That patient was accompanied by the family members, and that they receive the full care during the end of life. The last one, as this is the perspective from the Christian nurses, so they mention about the expected patient know their final destination. It's including they know who Jesus is and they accept God. If you are interested with the article, you may read yourself. It's in the Learn. You can access the article and you can read them. If you want to discuss with me, it's okay. We can discuss about the peaceful death. Now, announcing death. You know what comes on your mind when death is announced by the healthcare providers? Usually, it was a very quiet situation, maybe not comfortable situation, well, because no one expect with this kind of news. But actually you can do something, Like you can light the candle before the physician call the family to announce the death. You may put the music on. You may put some pictures of the patients or family members. Of course, that you need to plan for these things. You can plan this during the end of life care. You may use silence. You may ask the family members to have time to see their loved ones and to pay their last respects. When someone died, you will leave the digital footprint. Do the patient aware about these kind of things? What will happen with the digital world when they die? Kind of Facebook, Instagram, the bank account, the passwords to the emails and everything. Who have the logins for the emails, for the social media, for the other things? Now, care for the dead body. Is there any special requests from the family members, such as they want the family members to be shaved? Any special clothes that they want to be put on the patients? Maybe they want the Bible to be held in their hands, or maybe to put in the sides of the patient. You need to remove all the equipments. Remember, when you remove all these equipments, you ask permission because they still hear you. Do it nicely. Respect them. Cleanse the body. You may need to ask the family because this will be related to the culture and religion. Some religion that I know, like Muslims, they usually will clean the patient's body or will bath them with prayer from someone, from the chaplain maybe. So ask them. But make sure that you clean the patient. At least you clean the patient for any possible discharge from the body. Close the eyelids. Put back the dentures if the patient has the dentures. Close the mouth. Remove all the ornaments. Place under pad. Cover them with a clean sheet. Maybe you need to spray deodorizer to remove any unpleasant odor. Apply name tag. Allow the family to see the loved ones and document everything in the nursing notes. You need to hand over the dead body to the relative. Next one is planning for the funeral and memorial services. This thing is very sensitive, especially in Asian culture. But they should know about these things. Even though this is taboo, actually we all know. In Christian, we know that there is a life, there is also a death. And I believe in any other cultures or any other religion, they also believe about life and death. It is very great if a patient know where and when the funeral services will be held. Maybe they have arranged something. My experience working in Australia, most of the patients, they have arranged their own funeral. They wrote their advanced care planning. They have their own advanced care directives. The document that states all their needs, all their wants, all their wishes during the treatment or even after their death. I hope that in Indonesia we will develop these things. Is there any particular celebration or people that you want to be in your funeral services? Consider all the service options which patient prefer. They may prefer to be cremated or buried. Consider to reflect on some of the key features that the family members may also want to integrate into the service. Now, your role as a nurse after death. The spiritual and cultural wishes of the deceased person and the family is need to be respected. You need to prepare the body for the transferring and for the family members to view the dead body if the family members want. Maintain the dignity of the deceased patient. You need to return all the belongings or possessions to the family members. That's the end of the slides. I hope that you get so many information about end of life care. I know this is a very big topic. You may read more articles that available in the websites. You also may read the article that I mentioned before about peaceful death. And I also give you a video for you to learn about the symptoms during the end of life when the death is approaching. So please watch them, watch the video, read the materials, and drop your question if you have any questions in the discussion forum. Thank you so much for listening, and I'll see you next time. Bye-bye.